health workers in Nandi County are being trained on the financial and stress management by Kenya Progressive Nurses Association. The training targets nurses who are affected by COVID-19 pandemic while in assisting the patients during that particular period. Our reporter or correspondent in Nandi County, Isaiah Cheriot, now joins us live with more on this. Isaiah.
A very good afternoon to you, my colleague in the studio, Wanjiru Maina. As you've already said, we are coming live from Nandi County. You can see behind me, these are the nurses actually undergoing various training. We understand that they were really affected by the COVID-19 pandemic financially, and also they had a lot of stress. And today, they are actually being trained by the Kenya Progressive Nurses Association. And without much ado, it's a pleasure now to have Mr. Nyongesa, who is the chair of the same association, to tell us one or two things over the same. Karibu sana katika runinga K24, Bwana Nyongesa. Today we are having this particular nurses drawn from a number of counties. What is it? What is going on here today?
Okay, let me start with my name. My name is Michael Nyongesa, National Chairman, Kenya Progressive Nurses Association. As a professional body, we take care of professionalism and quality nursing care around the country. And so when Corona hit the ground running in this country, nobody was prepared. So the nurses were on the receiving end because it was them to take care of the Corona patients. And workload also increased because, as you may know, today in this country we still have shortage of staff and nurses in this country. So the few nurses who were available went into supporting also the Corona patients. And this in itself brought up very many issues. Number one issue that came up was burnout. Burnout during working, it caused stress to many of our clients, of our nurses. Number two is that nurses did not understand what was going to befall them, because everybody was asked to work from home, but nurses were asked to work in the hospital during the period. Number three is that even in the family, people were separated because of Corona. Some spouses who are not nurses thought that nurses would bring Corona to them, and so they walked away from nurses, and this brought a lot of stress in the mind of nurses. And that's why, as a professional body, we have worked on a program where we want to train our nurses on stress management.
Very well. So how many nurses do you have here today, and are they drawn from Nandi County alone?
Thank you. Our program is running throughout the country, and we are handling each county at its time. So today, we are here with nurses from all over Nandi County, and we have close to 100 nurses with us today to take them through issues of stress management and financial management.
Very well. Thank you so much, Mr. Nyongesa, for your address. We can have my colleague in the studio, a lady here, to also comment over the same. Maybe tell us your name and why are we here?
I am Priscilla Wangari. I'm the lead trainer and the managing partner at Peak Premier Consulting Limited. And at Peak Premier, what we do is training and capacity building, having been certified by National Industry Training Authority. And today we are here because we partner with the nurses through KP